Hi class, it's Dr. Lindner. In this video, we're going to be focusing on connective tissue. Now, when we look at connective tissue, we have a few main categories. We have connective tissue proper, supporting connective tissue, and we have fluid connective tissue. Under connective tissue proper, we have loose and dense connective tissue. Under loose, we have areolar, adipose, and reticular. Under dense, we have regular, irregular, and elastic. Okay, so that's connective tissue proper. Under supporting connective tissue, just think of what's the primary support system of the body. It's going to be bone and cartilage. Under bone, we'll talk about compact bone, and we'll talk a little bit about spongy, but primarily focusing on compact. And under cartilage, we'll talk about the three flavors of cartilage, which is hyaline, elastic, and fibrocartilage. And then finally, we'll talk about fluid connective tissue, which is blood, and we'll focus on red blood cells and white blood cells. So under loose connective tissue, so we're going to be talking about this category first, okay? So loose connective tissue, this is like the packing material of the body. It surrounds and supports your blood vessels and your nerves, and it stores lipids, and it's involved with the route for diffusion, and it fills the spaces between your organs. So we'll talk about areolar, adipose, and reticular. Under areolar, this one here is made up of different types of cells that we can see. We have fibroblasts, you can see here. We have plasma cells here. We have macrophages and mast cells. Here are some mast cells. Here are some macrophages and some white blood cells, right? We have some eosinophils, maybe have some neutrophils here. And there's different types of protein fibers, collagen, elastin, and reticular fibers. So we've got some collagen here, and we have some elastin here. And there's some ground substance that we can see. Maybe it's gelatinous. Okay. The areolar tissue is going to form the layer that separates our skin from what's deeper to it, which is muscle. Right? When you pinch your forearm or the skin on your forearm, it separates the skin from the muscle below. It's an area that has very, very good blood supply. And as a result, it's the common site for injection of many medications and drugs. Adipose, when we look at adipose, it kind of looks like a squamous cell. But look at where the nuclei are. The nuclei are off to the periphery, where in a squamous cell, right, the nucleus would be in the center. So it looks like a squamous cell, but when you see the nuclei in the periphery, it's a fat cell. So the periphery of the nuclei are in the periphery. Fat cells are involved in keeping people warm. So it's involved in reducing heat loss. It's involved in energy storage and protection. Energy storage because triglycerides are stored in fat cells. And really, that's what a triglyceride is. It's a fat cell. It stores energy. Fat cells also store toxins. And this is why we never really see morbidly obese insects, because insects lack fat cells. And that's why when insects invade farms and crops and they digest Roundup or the glyphosate or these pesticides or fungicides or herbicides, the toxins go right to the neural system of the insect, whereas humans have fat cells and we can store those toxins. And little by little, these fat cells can rupture, releasing the toxins going to the liver to help break down these fat-soluble toxins for elimination. The number of fat cells that humans have increase until the time of puberty, and at which time they just increase in size. So body composition is really important to manage until the time of puberty. The more fat cells you have at the time of puberty, the more fat cells you have to manage through the rest of your life. Liposuction that people do, it's a temporary fix because fat cells can be created from mesenchymal cells. These are stem cells, and they can regenerate fat cells. So liposuction is not a permanent fix. Okay, and when we look at fat cells and we look at obesity or morbid obesity, now these are people who have a high amount of toxins throughout the body, and this is where they're stored. It's a protective measure. These toxins that they're taking into their body, they're storing them in fat cells. And little by little, these fat cells can rupture, send the toxins to the liver, and then eventually the kidney for detoxification. Okay, so we look at obesity with a different viewpoint, not just people like to eat, but it is a protective measure to protect the neural system by having a place to store these environmental toxins. Reticular connective tissue, it's made up of a network of fibers and cells that produce really the framework of different organs. So it holds the organs together, whether it's the liver, or the kidneys, or the spleen, or lymph nodes. Now, dense connective tissue, we're going to be looking at here, dense connective tissue, regular, irregular, and elastic. So here it's made up of, we're looking at for dense regular and dense irregular. Dense regular, we think of tendons and ligaments. It's going to be made up of collagen fibers that are nice and aligned. Where dense irregular connective tissue, this is found in like the dermis, fascia, surrounding organs like the liver and the spleen, and these collagen fibers are not going to be tightly interwoven, but perhaps in different directions. Elastic connective tissue, these are found in the walls of arteries. They give them their elasticity, even spinal ligaments for elasticity. So let's take a look at these two. I'm going to bounce back and forth, dense regular to dense irregular. When we look at dense regular, look at the collagen fibers. You see how parallel they are to one another, right? The collagen fibers are found in these parallel bundles. These are in tendons, ligaments, and even aponeurosis. Aponeurosis just means broad, flat tendon. So that's dense regular connective tissue. We go to dense irregular, look at the collagen fibers here. They're all in different directions compared to here. So the tissues can resist tension in any direction. So if you rub your eyeball, let's say, you don't just have to rub your eyeball left to right, left to right. You can go up, down, left, right, diagonal. And that's because of the fibers running in all these different directions. It's a very tough type of tissue. It's also found in the dermis of the skin. So when you get soft tissue manipulation or massage, the LMT or the licensed massage therapist doesn't just have to do strokes of massage up, down, left, and right, but they can manipulate the tissues in a variety of directions without tearing the skin, unless, of course, the person has some sort of genetic soft tissue disorder. Elastic connective tissue, it's made up of these elastic fibers. This allows the tissues to stretch, but yet still return to their original shape, like the walls of arteries. They can dilate and constrict. We also find them in the lung tissue and the vocal cords, the ligaments between vertebra. And since I mentioned the vertebra and the ligaments, certain joints need more elastic tissue and others need more collagen. So when do we need more elastin? When do we need more collagen? Depends on the joints that we're looking at. If we look at the spine is pretty stable in relationship to the knee. The knee is the largest joint in the body. When we look at the junction between the femur and the tibia, the distal femoral condyles are round and the top of the tibia is kind of flat. So when you put a round surface on a flat surface, it makes for an unstable condition. So it's more important for unstable joints to have more collagen for strength and stability, but the spine that's already pretty stable based on the articulation of those facets, but the spine is very flexible. We need more elastin in the spine and we need more collagen in the knee. The spine's going to have collagen and elastin. The knee's going to have collagen and elastin. It's just which do we need more of? Since the spine is already more stable, we need more elastin. Since the knee is very unstable, we need more collagen and less elastin. Now, when we look at cartilage comes in a few different flavors, okay? So I'm gonna come back on another video to just focus on cartilage, so hang on tight.